viewers. How are you today? Welcome to Women's Health Tips with Sarah. Today we're going to talk about menstrual cramps and its remedies. Before we go further, I'd like to encourage you please subscribe to this channel. I'm not doing this video for myself, but my aims is to create this video for women out there that need this video, and how would they be able to make use of this video is by you, my viewers, those of you that have the privilege to go to YouTube. You be my partner. How are you going to be my partner? By sharing this video to people in your contacts. That way, people that need to view this video will be able to view it and make use of this information that I am providing. So, thank you and welcome. Today we're going to talk about menstrual cramps. So, how does it feel when women have menstrual cramps? As you could see in this picture, you could see that lady. That's not a happy mood position that she is. That position shows that something is wrong with her. So these are things that bother women daily. So um, just to give you another clue of what happens to women during menstrual cramps is the picture that I'm providing right now. You could see these four ladies. Their faces doesn't look like someone that's happy. They are in pain. So, and these pains affect us daily, every month, as we have our period. So most women do have these pains. Personally, I want to say I did not experience menstrual cramps, so I don't take it for granted. I am really grateful for that. But some women do have severe menstrual cramps. So how do we manage that? What are menstrual cramps? Menstrual cramps. So before we know the management of menstrual cramps, we have to know how it works. What happened? What causes menstrual cramps? So menstrual cramps are pain located at the lower abdominal area. It can be trembling, it achy, and it occurs before and during menstrual cycle. So some women may have these pains prior to their period beginning, and some of them continue to have it even when they are having their flow. So it affects many women. The cramps can range from mild to severe. So some people can have a mild pain and they just go about their business, while some might have severe pains and they will not be able to function very well in the day during the day. So that some of women may have pressure in the belly, pain around the hips, lower back pain around the inner thigh, and sometimes this pain goes away and it differs with age. Severe cramps may lead to upset stomach. So um, it also make somebody vomit. As individual may have loose stools. For me, when I was having my period, I wasn't having cramps, but I knew I do have loose stools when I'm having my period. So the hormones kind of have effects on the intestine, and one can have loose stools, restlessness. Of course, you're having pain. Why won't you feel restless? Those are the things that occur when a woman have cramps. Causes of menstrual cramps. What causes it is a contraction in the lining of the uterus, known as the womb. Remember, another word for uterus is womb. So when you hear the word uterus, so it's womb where the baby stays. When the muscle contraction is strong, it puts pressure on the blood vessels, which lead to less oxygen in the uterus. So when as stated here, if the contraction in the womb is strong, that contraction is not the one that we have when we're having babies. These are just the minor contraction, but to some individuals, it's severe. Lack of oxygen to the inner lining of the womb can cause pain. Of course, when a woman is having pains, contraction, another word for pain is contraction, there will be possibility of lack of oxygen going to that area. So that predisposes the woman to even have more pain. Other causes of cramps are fibroid. Women that have fibroid is a benign growth that how that is being housed in the womb, find its place there and have a lot of high blood supply going down there. So in the womb, when a woman has fibroids, so they do have severe cramps. Pelvic inflammatory disease is another causes of cramps. So we have to eliminate the fact if the woman is having fibroid, if a woman is having pelvic inflammatory disease, especially for women that traditionally they were not having menstrual cramps before, and then all of a sudden they started developing menstrual cramps. So there might be a test order ultrasound to see if this individual is having fibroid or pelvic inflammatory disease. There will be a scan, I'm sorry, a test to be carried out, especially it could be a swab test where specimen is will be taken from your VA, and VA is vaginal, and or a urine test will be conducted to see what is causing the cramps. Narrowing of the lower part of the uterus, known as cervix, is called cervical stenosis, can cause menstrual cramps. Adenomyosis is an extension of the lining of the uterus to the nearby muscle. If the lining of the uterus is being extended, means extra growth is growing out of where it's supposed to be and extend to other places in the womb. It can lead to menstrual cramps. Another causes of menstrual cramps is known as endometriosis, the growth of the lining of the uterus outside the uterus. So if there's outside the uterus, there is another growth in there. So it can cause pain, cramps. So it's always advisable to visit your doctor just to rule out if this cramps is just a normal menstrual cramps or it is related to something, just like I mentioned with the fibroid, with pelvic inflammatory disease, with cervical stenosis, which is the narrowing of the cervix. So it's good to rule out what leads to cramps. Another thing that puts places women into risk of developing cramps is women under the age of 30. So women from the age of 11 and above may have menstrual cramps. Also, heavy bleeding. Women that have severe heavy bleeding may develop cramps because the uterus is contracting. Irregular menstrual bleeding can also be a risk factor for women to have cramps. Family history of menstrual cramps. Some family do have history from generation pass on that have history of menstrual cramps. Smoking. This is a pattern here. If you go back to a previous video that I share with you, you will notice that smoke is always there as a risk factor. So be careful for those of you that smokes so you could know what to do that when you're having menstrual cramps, at least during that period, I would advise to stay away from smoking to minimize the pain that you have. So what are the management and treatment of menstrual cramps? Um, The remedy that can help with menstrual cramps could be frequent rest, avoiding fatty foods, caffeine, and salty food. Massage lower back and abdominal area. Reduce your stress. Take supplement as directed by your practitioners or your physician. So please, also a little bit warm water can be placed in the lower abdominal area to reduce the pain. And exercise too, if you can, you be able to will help to reduce the pain. Another thing that can help reduce the pain is finding what works for you. What works for you when you are in pain. So is it resting? Is it taking a walk? Is it watching movie? Diversional therapy, anything that can help you divert your attention from the crimes will be very helpful. And again, if all these measures taken is not working well for you, the best thing to do instead of suffering in pain is to take over-the-counter medication as Motrin. Another name for Motrin is called ibuprofen, or you can take Tylenol. Another name for Tylenol for other people that may watch this video from another part of the world. Tylenol is the same thing as paracetamol. That can help reduce the pain. And if the pain is severe, as I mentioned before, you can contact your primary health physician or your nurse practitioner to get evaluated on why your pain is very severe. So thank you for watching this channel. Please, I encourage you to share this video, as I said in the beginning, and most importantly, please subscribe to my channel. I'm dedicated to what I am doing, and um, whenever I have the time and opportunity, I will always update you with new information on women health, new treatment that come up, new issues concerning women. As I said, I'm not going to jump this video and just randomly talk about issues. I'm going to do a step-by-step presentation of women health issues. So again, thank you and remain blessed. God bless you.